Hello, my name is Alicia Payment. I am a student at Lake State Superior University. I am in the Peds and OB portion of the BSN program. I chose to do my presentation on factors that contribute to elderly mental health. Mental health in the elderly. Mental health affects about 1 in 5 Americans, and according to the National Institute of Mental Health, 44.2% of adults aged 50 and older received mental health services in the year 2017. Factors that affect mental health include functional decline, relationship changes, financial status, and decline of physical health. It is important for a healthcare provider to be able to identify mental health issues and then to help the patient to seek further help. Functional ability begins to decline as a natural part of the aging process. A study that was done in Brazil found that only 44% of nursing home residents aged 60 or older were able to maintain his or her functional ability at the 2-year mark. Results were gathered every 6 months for 2 years from 10 nursing homes. This leaves 56% needing extra care to maintain their lifestyles. What was monitored included eating, personal hygiene, dressing, bathing, transferring, toileting, and walking. Additionally, aging processes that are part of everyday life, including decreased hearing, impaired vision, and memory issues, also have an impact on the elderly's functional ability. A decline in physical ability makes it difficult to maintain activities of daily living, as well as makes it harder to partake in activities that were previously enjoyed. Physical activity decline can be caused by decreased muscle mass and decrease of cardiovascular capabilities, which may lead to a decrease in energy, overweight, obesity, hypertension, or bone loss and softening. According to the CDC, 80% of older adults have at least one chronic health condition, and 50% have two or more. And the likelihood of developing depression increases with comorbidities and limited functional abilities. Changes in financial status may cause a burden to an older individual. Healthcare costs may become impossible to pay or keep up with. In addition, you have to pay for medications, co-pays, and the cost of screening procedures. And oftentimes, these people are living on a reduced income. The lack of financial support may lead to inadequate nutrition, not getting prescriptions at all or getting them refilled late, and then worry, uncertainty, and anxiety. According to the Kaiser Family Foundation, in 2016, half of all people on Medicare had income less than $26,200 per person. So that means that more than 7 million people ages 65 and older had income below poverty in 2017, based on the supplemental poverty measure, 2.5 million more than under the official poverty measure. The SPM bases its numbers on geographical location, home ownership status, taxes, and supplemental resources such as food stamps, as well as out-of-pocket medical expenses. If the elderly person has to choose between eating or paying his or her medications, it will cause increased worry and uncertainty, which will heighten the chance of developing anxiety. Overall, an elderly person burdened with financial instability is more susceptible to experiencing a decline in mental relationship statuses and roles change throughout a person's life. This is especially prevalent with the aging population. Instead of being able to provide for his or her children, he or she may become dependent on the child. Although the elder is still the parent, some struggle with the idea that his or her child is now the parent, as the child may be assisting with financial, physical, and emotional support. One spouse might be more dependent than the other if they require extra attention for medical reasons, or the spouse may even be deceased, which leaves the survivor to grieve and relearn to live independently. Sexual changes are also common. Our book lists factors that may hinder sexual desire or pleasure, including erectile dysfunction, medications, relationship difficulties, chronic illness, lack of privacy, and even lack of interest. It is important to understand that relationship changes are common in elderly patients and may contribute to anxiety and depression, and that there are many interventions that can be done to improve relationships or an individual's outlook on the relationship. Depression, anxiety, and dementia are not a normal part of the aging process, and it may lead to social withdrawal, isolation, depression, suicide ideation, or even suicide. Functional, physical, financial, and relationship changes may lead to emotional distress. This may cause the individual to withdraw from society and events that they once enjoyed, which only enhances feelings of loneliness and alteration of mental health status. American Foundation for Suicide Prevention listed suicide as the 10th leading cause of death and broke down the rates out of 100,000 people according to the age group in the year 2017. 15.56% for ages 65 to 74, 18.01% for ages 75 to 84, and 20.1% for ages 85 and older. These numbers can be greatly reduced through regular mental health assessments and compassionate care given to the elder population. So what can be done? Monitor and assess for the factors which affect mental health. Screening will promote optimal mental health and even prevent it from becoming worse. There are many options to promote mental health, including discussion, education, community resources, counseling, and medication therapy. There are many free and even anonymous resources available for mental health. The National Suicide Prevention Lifeline has a 1-800 number that connects the caller with a crisis support person who provides emotional support as well as resources. There are many community events and gathering places available in almost every community. This could be a church, a recreation center, or even a library. Facebook has community groups that can connect people with similar interests. For example, a basic search of crafting in Facebook's search engine will bring up groups near the person's location that would allow the person to join the group with similar interest. Volunteer opportunities are another valuable resource for those struggling with socializing and support networking. Typically, there is a place in each community, such as United Way, which can help people to find volunteer opportunities. Some other good places to suggest would be animal shelters, Salvation Army, schools, and hospitals. Health Promotion Model by Nola Pender in 1982. The health promotion model is relevant to the topic of mental health as it focuses on being able to perform at the person's best ability rather than focusing on the absence of disease, especially as much of the elderly population is dealing with comorbidities. It can be used to develop goals with the patient that will improve their overall health and well-being. The goals promote positive health behaviors to improve health functionality and increase quality of life. SMART goals are specific, measurable, attainable, relevant, and time-bound. For example, if a person is recovering from hip surgery and is beginning rehabilitation, a SMART goal would be to walk 10 feet without assistance from the walker by the end of the week. This goal allows the patient to gain self-confidence in his or her ability to attain the goal rather than feeling disappointed when the goal was not obtained. This model focuses on improving overall quality of life. It is about teaching the individual to do the best with what they have. Conclusion. Mental health issues are common in the elderly population. Anxiety, depression, and withdrawal are signs that a person is struggling with optimal mental health. With assessment and intervention, care providers can improve mental health. Develop SMART goals with the individual, provide community resources in social event happenings, and most of all, reassure, listen, and help the patient to promote optimal mental health. Here are the references for the information presented in the PowerPoint. I hope that you have found this useful. Thank you very much.